Boutiques on York in Rockville, Indiana, 100 West York Street, celebrating our 10th year in business.
All right, it is 6 o'clock. We have 3 members here. It is a quorum since our total board count is 6. And we'll start off with the role of the health board for 2024 updates. I will be emailing the board and staff the latest legislation associated with the function, roles and responsibilities of the health board out. It was too much to put in your packets tonight. But basically with the introduction of Senate Bill 4 and the Health First Indiana, there was a lot of moving pieces associated with that, and then the oversight and the responsibilities of the health board. So just wanted to let you know you'll be getting that link. That is usually part of our annual board orientation that I started last year and then bringing forward this year. But I will say, to be fair, I want to be clear that when we have requests for funding that goes to the council, it has to be approved by the health board. It cannot be like independently going and requesting items. Even if it's from a good place, it has to come from the health board. We have to action on it, and we have to ensure that we're following the rules as set forth by the state statute. So just wanted to kind of put that out there. In terms of Health First Parke County, there is a packet just as a sample that was part of our first meeting that we had in January. We had our second meeting this Tuesday. I would say that we have so much encouragement from partners that are coming around the table and really helping us to identify, what resources and abilities that they can help with us as a health board to really get this foundation of Health First Parke County off the ground. Because when we talked about what was known as the GPHC, or the governor's appropriated funding that is now called Health First Indiana, our initiative is now Health First Parke County, as you can see from the handout there. We are responsible, even though our budget that we approved and it was appropriated by the council and such, we are still responsible for all core services that's identified by the state. And so in that packet, there's 2 pages, and it's not new information, and it's not changed from when we first had our introduction. These 2 pages outline our core services that we are responsible for delivering to the citizens of Parke County. And enabling that requires partnerships, because we have 1.5 staff members here plus a contract. And, we can't be everything to everybody, because this is a very, very broad scope, ranging from sanitation to immunizations to piercings and tattoos and food inspection. And so we have a lot of partnerships that we're going to be engaging, I would say this year. And our goal is to get to every township in Parke County to offer some form of outreach and some services that we identified in our initial plan that we put forth and enacted as the board for this past year for going into this year. I would say that the other step that we have started conducting as part of the Health First Parke County is an internal audit of our services. And that means that from vital records to emergency preparedness, immunizations, all the things that you see listed on the core services, we are doing an internal audit to find out how much are we performing those activities, what level are we performing those activities, and if we are performing those activities, then what are our strengths, our weaknesses, our opportunities, and our threats. And so this internal audit has been taking place over the course of probably the past week and a half or so. And what that will allow us to do as a board is to set forth, and with our partners from the Health First Parke County initiative, is to set forth our health plan. and our priorities as we look at subsequent years of funding. And I would say just from this exercise, it has been enlightening to say, okay, if I really have to sit down and think about the core services and what my role and function is here, how am I performing? What are we performing? And, you know, again, it's so much. I mean, 1.5 people, lots of work. So, Liddy, I know you've started working on yours, and so what's some of your feedback and recommendations just preliminarily?
For preparedness, I had previously had an independent contractor who helped me, and I think it would be beneficial to see if there's somebody out there, just because of the increase in just responsibilities all around. And they've added like the tattoo things. Complaints have increased probably tenfold since I started, and these are people that they're out in the middle of nowhere. The complaint is, you know, trash, rats, whatever, and then additionally, and they shoot at me when I go out. And so they come to me, and I don't really feel super well equipped to go out on my own to do those kinds of things. So between complaints, the vital records, even maybe the preparedness or the tattoos, that type of thing. First of all, the town has an ordinance, the county doesn't, so we need to work on that. But maybe an individual could be contracted to do part or all of that. When you look through the fund reports, we've still got, I'd say, close 150 to 200,000 in the vaccination and testing funds, which could be moved into another fund. Those funds could be used to hire some independent contractors. Yeah. And even further, I have approached the state before, because they do allow me contracted employees during festival, but literally almost every month there's a festival in Parke County. In June there are 3 in one day, and you've got 2 or 3 in March. And if they could be used to do some of that, I've got people that work for me during the festival that would probably be willing to pick up some of it, rather than have me continue to accumulate comp time that I never get to use.
Yeah. So with that being said, you know, the internal audit to Liddy's attestation has really provided us with a lot of enlightenment around, you know, we're working really hard. But, you know, with all the expectations coming from, you know, the Health First Parke County and upholding these core services, 1.5 people can't do everything for everybody. And so, you know, Liddy and I talked, and, you know, I really think that, you know, at this point, I think that we need to pause, at least right now, on the emergency preparedness and get some transaction out there to advertise for a contracted employee for her. Now, I'm going to kind of pause right there, because I know that we have some outstanding business as it pertains to her work and her payment for the year 2023. So let me pause. So let me pause right there, because we're going to need to take a vote right now between the 3 of us. So, I guess Angela and Mary Jo. Mary Jo's on as well. Today I went to the council meeting this morning and had a very productive meeting. We have approval for Liddy to get the check cut for the 2 months that were 2022 that didn't carry over to 2023. That is done, actioned by the council. The second part of that was the last 6 months of her 2023 payment, and that was $16,000, whatever was in your email, the $16,000 some dollars. That they wanted to push back to the health board and for us to weigh in, and if we approve that, then we will get those 6 months taken care of for 2023.
Okay.
So at this point, for us to get that 2023 payment, we'll need a motion and a second.
And did we have the money back then? Did we have the money to cover that?
We approved it back in.
Okay.
Yeah, so this is just them coming back to us to say we need that to go back up to the auditor. The claim will not need to go back through the commission or the council body. It's at our discretion, so we'll action on that tonight.
Okay, well, I make the motion.
I think that you're the second. Angela was the first.
Okay.
I
You're
don't know
quieter
that you
than
can
me.
use.
Well, she's whoever it was.
And I think that's a great idea.
Yeah, yeah. And I approve it too, because like the by proxy and the electronic votes, we'll want to keep that clean. But in checking with Nick before, he said that we could do that. But at any rate, so we're going to pass that since there's three of us here. And we'll hit the pause for 2024 since we're a month in, and then we will get a contract put together and that transactional piece. Now, we've identified, like Liddy said, there's many opportunities for us to work to get the bandwidth or the personnel to get these core delivery pieces done, and we are in the very beginning stages of our internal audit. But with that being said, we can go ahead and approve us moving forward on the EP contract and that, so that we can get that published. And I think that we will also need, is that a second that we need for maybe some funding for
January through June. They anticipate that the amount will remain the same for
Okay.
24-25, but that amount never comes out at the time of the letter of intent.
Okay, so for the January through June, we had actioned as a board for the 2024 appropriation that was not actioned on
Right.
with the council.
It would have been 9 something and then plus whatever. And I don't know if they encumbered the money for the, what did we put it under?
The 9117.
Yeah, but the extra money for supplies, I don't know if they encumbered it. I don't know if they had to, but it wasn't approved either.
Well, we'll get the supplies. We'll just need to have a list sent to us as the board electronically of what we intend, because that's what the whole point with the request for the inventory.
Right.
So we'll need to identify that supply line, and maybe with the Health First Parke County conversation, we can identify what those supplies may need to be based on the needs assessment from that 9117 line. But I was also saying for the transactional contract piece, we may need to allocate some monies for the attorney to check the box. So, we'll get that piece turned around, but again, we'll enact that as the health board. But we also want to make sure from a legal perspective that they're also checking that box, since we'll take that to the commissioners once that's prepared. So,
So did you say we need a second on another motion?
well, I think that we need to have an approval to put the contract to go forward with a contract for a person to do the emergency preparedness work. And then secondly, there may be some additional fees associated with the legal aspects of that to cover that. And so we would then have to determine where we would want to pull those out of the lines when it comes time for that. So I don't have the amounts, but there's an hourly rate that I think our county attorney has for him to look at and just check the box so that it goes to the commissioners and it cleanly navigates the process.
Which I think he was probably the attorney at the time I prepared that, so.
We talking about Nick?
I know, I ran it by him at the time.
Yeah.
So first you need a motion or a second on the transactional
Well, I can make
employee?
the motion for the transactional piece to do a 1099 employee to do the emergency preparedness piece initially. So I'll stop at that one.
All right, and then I'll make the second.
Okay. Is there anybody opposed to that?
No, I think that would be fine, as long as they're gonna get paid in a timely manner.
Right. Right. I think that was some of the
I mean,
issue
I'm
that.
just saying, that's not very good.
Yeah. Yeah.
I have found that most other people won't work for months and months with no pay. Just me.
Yeah. Yeah.
Just me.
So then I would say, as we complete the rest of our internal audit and the recommendations for supplemental help around some of the tattoo, the piercings, the eyelashes, we need to look at what our memorandas or partnerships or 1099s need to look at to help make sure that the role that you play, because it's a big role, is going to be met. So, and then once we get this transactional contract piece, I can send it out to the board for comment, but it's pretty much, it's
pretty
been
standard,
done in the
yeah.
past. So, but with your motion, we'll go ahead and move forward with that and get that taken care of.
Okay, and then do you need a motion to put some money aside for attorney fees?
I think so. And yeah.
Since there's
Second.
only
Yeah.
4 of us here,
Yeah.
I guess.
I think so, but again, that'll have to come back. I'll send that electronically, even though you guys are motioning into what that actual amount is, and then we can work with the council on where they want to move the funds from which line. But we do have the 1168 and the 1206 that we've got to spend down, and so we've got money right now for this transactional piece to be able to help uphold our core services associated with the Health First Parke County Fund.
So, we have a lot of tattoo and piercing.
Well,
The
There
beauty
are-
shops probably.
there are the 2 or 3 in town that have been inspected. I know personally there are some in town that folks are doing them at home.
They're pop-up markets.
Yes. We don't really have an enforcement officer. I mean, if I find one, the police normally will go out and but the county doesn't have an ordinance, so there's
So we've got to do
nothing-
that as a board. We're going to have to recommend an ordinance to the commissioners so that we can have that countywide, because we don't have one. We have one in the town, but not in
And you're
the.
talking about criteria for inspection. Is that what you're
Yes,
talking about?
and
To
or
meet-
permitting, yes.
Okay.
And it's I think it's one of the core.
So this list is extensive, and that's why we're.
Question.
Yeah.
I know independent people doing out of their homes, like lashes and things like that. I mean, how are you gonna find those people?
Somebody
Unfortunately,
surf Facebook?
if you're on Chatter or Facebook, you're going to find it. It's a fine line. I don't know legally whether that's something that, it's the same thing with people advertising their pumpkin rolls.
Oh,
Huh?
And
you have to
I,
inspect their kitchen?
as one person, you weigh whether, now there was somebody that catered a large public event that did not have a certified kitchen and did not have a permit. I followed up on that. But it's kind of, if somebody wants to buy a pumpkin roll from somebody they know, I don't know that I have the time or authority to try to hunt them down and say, hey, if you don't have a certified kitchen, you can't sell them.
But I think
Well, I
that.
just know
Go
I've seen
ahead.
some people advertise on Facebook and they're certified to do it, but I mean, what?
One of the ones you
requirements
might
do
be
they
thinking
have
of, I
to
think,
meet?
lives in Vermilion County, so I'm not concerned with her, but I have seen some others mention that they do it. And again, I guess that's a question for you,
I think it's a question for our central region.
maybe so.
I think that would be a question for our central region that we can follow up on, because they do have resources available for us through this Health First Parke County funding. And they have an attorney on staff as well as some others with sanitation and the like. So we can definitely check with them to see how maybe other counties are regulating home-based services. And that way we can at least have a footprint to go from and not just try to reinvent the wheel on our own.
Yeah. I was just curious because I just didn't know how, if they're certified, I guess they'd had to gotten certified. Would they be like on the Secretary of State's website as licensed, or, I don't even know how far that goes. I have no
Well,
clue. I was
and
just
to be honest,
curious.
it's mainly having your bloodborne pathogen, having an autoclave, having a sharps container. it's not super extensive, although some of the lashes, they have some, obviously some trainings and some classes they have to have. The estheticians have to have so much, and they've all got cards they can show you. So if there's,
Okay.
yeah,
So we'll follow up with the central region to kind of identify what other communities have done and what kind of ordinances they have in place. And, we'll try to, as we get through this internal audit, of course, that'll come back to this board for review because
I know there's people that even have like Botox parties and things like that, which I'm not going to a party to get Botox. I haven't got Botox anyway, but it's kind of like a Tupperware party. You go and you buy your stuff
yeah.
and they do it. So I didn't know how we would control that or monitor that.
Yeah, I think that, what we'll find is that those one-off situations aren't something that we can probably regulate, but those with more intentionality and advertisement are going to be the ones that we have to make sure that we're inspecting. So, but we'll double check with the central region just to make sure that we have that clear definition. And then, of course, then we also need to educate the community regarding those things. So, some people may not realize or know that those are regulations that they need to follow.
So we need some
Right.
kind of informational something to give them, or
I think that with
Advertising.
we can advertise it because that ordinance when it comes out, and then yeah.
and there's some people that are willing to go to some place with dim lighting and let somebody tattoo them.
yeah. I mean, people get their eyebrows tattooed or
Eyeliner,
eyelids,
yes.
yeah, tattooed, and
Yeah.
Yeah. So that was some action in the Health First Parke County initiative, but, wanted to get that here since we are on a quarterly session so that we can get that transactional piece with the EP grant, and then start working on these internal audits and then come back with recommendations around where we find additional gaps, because this is a foundational year. The state would tell you that. And I think that from Parke County, we have quite a bit to prove to not only our community but our governing bodies to ensure that we've got the right momentum moving forward. And it's going to take a lot of effort, I would say. I mean, it's when you look at this list, it's a lot, and we have to set key process metrics for each of those.
all right. Are we breaking it up over the course of
No,
meetings?
we're meeting every month as the Health First Parke County group.
Oh, okay.
Yep, and then that's why we set it so that it's before the health board meeting. So if things need actioned here, we're bringing that forward from the committee.
Okay.
So, Dr. Hatfield, is there anything that you want to add from the Health First Parke County initiative? I know you've been part of the first 2 meetings.
The big things, like we talked about at the meeting, for the partnerships for the they're going forward, as we talked about. It's not, enough, and however, it's department, against,
Okay. All right. Any other questions on Health First Parke County? Sandy or Melissa, you have anything to add? Okay.
Besides the doctor and you, probably, who else is on the
Oh,
bunch?
we have Catholic Charities, Thrive West Central,
Purdue Extension.
Purdue Extension. We had, was it Gina from the state that was at our last meeting, and Mike Sutton from the state attended our first meeting. Julie was at our first meeting. The hospital, Kale, Will, Cindy Todd from Partnership, Parke County. There's quite a few on our list. Oh, Hisham Ramuni from the Luger Center.
Good.
Quite a few. It's been very encouraging. I mean, it's been daunting, but it's been very encouraging because, I mean, some of the stories that are coming out, and then, of course, you know, we've got to get that transactional piece, that contract put together and advertised for the mobile integrated health piece as well, that we funded. And so that'll be coming up as well because we've already actioned on the mobile integrated health plan and the budget on that. So that's just another one of those things that the attorney's going to have to look at before we get that put up on the website. So it's a lot.
Sounds like it.
Annual health department report, that is a requirement that we have to do as part of the state. Janet did send out something, didn't she?
She told me, I think she's got the year-end amounts for all of the funds.
But that has to be submitted, doesn't it?
The one, yes. Let's see what she said. Documenting discussion of the election of the chair and vice chair needs to take place. The fee disbursement paperwork.
What about
Oh,
the
there.
chair and the vice chair?
Yeah,
Supposed to elect.
Oh,
She said-
today?
Yeah.
Yeah.
As far as
Probably
year-end
need to do
reports, I have a sales summary ready for the year as well as year-end balances for each of the funds. I can provide vital records info for the year. As far as the annual report needed by the state in Re the 1168 and 1206, I'm unable to prepare that without the board deciding what we are doing with those excess funds.
Oh, that's not the annual report, though. That's a different thing that got sent out last week that
And I can't answer.
Okay, so we'll pin that for now. So, let's, I guess, appoint a chair and a vice chair. There's three of us here.
What are the duties? Just, you run the meeting, you know kind of what's going on, but, I mean, still trying to get my head around it with all the new funding and everything. I would gladly be somebody's vice chair.
Sounds like Patty wants to make that motion.
That I, what?
That Stephanie stay on his chair and
Oh, okay.
Ronnie be vice chair.
Yeah, that sounds like a good motion to make.
Somebody will have to second
I
it.
make that motion.
Melissa and I are seconding fools, but we can't do it.
Yeah. So there's the chair and there's the motion. Somebody needs to make a second.
I can't second it.
I second.
There you go.
So, I'm
Or
like,
make a counter
I
motion.
seconded it.
okay,
Just moving things along.
all right.
Nobody's gonna knock you down and take your job, that's for sure.
Now, don't be complaining when I transcribe these minutes and it's Patty. I'm just teasing.
Yeah.
Okay.
did
Health
not
officer
do-
report, we'll pin that because Doc Swaim's not here. How about the food inspection, sanitation, and EP?
EP's chugging along. I have been working on one of our deliverables is rewriting or reviewing and updating a lot of our plans that have kind of taken a backseat to COVID for a few years. So we're meeting a couple of different days to kind of share or for me to share with people who haven't had any plans. Sanitary and soil reports are starting to roll in with people wanting to start building in the spring. Food inspections, I think I'm down to 2 people. I usually spend January dunning and Facebook stalking folks that won't get their permits. It's usually the same few every year. They pay the late fee. I think I'm down to 2
Oh,
that I need to get
not bad
after.
for early
Yeah.
February.
Yeah, and one has never done it before, so I need to find out what's up with that. Have spent since November trying to get a septic ordinance in effect, which I sent out. I think you sent
Yeah,
it
it's
to-
in your packets.
They've changed the way they were going to do it. The entire state has been without an ordinance since last July. Luckily, our fees were in our fee schedule, so we could still collect fees. It really affected a lot of the stricter counties more than it did us because they were a lot more restrictive than the state. The state at first didn't have a template, so we were kind of winging it, and I worked with Kim Hawkins from Vermilion County. Then the state came up with a template, so we worked with that. And then you were supposed to get it adopted locally, and then you weren't supposed to get it adopted locally. You were supposed to send it to the state, and then you weren't supposed to send it to the state.
It has been a little
Review. So
bouncy.
I think we are on my final revision, which is what I included. I included what Alice Quinn from the state made suggestions about. I've made
The
those
on-site
corrections.
sewage systems ordinance.
So read it at your leisure. It's quite enthralling.
Do you need a
Unless-
motion on this?
Not necessarily, they just wanted me to share it with you. If you read through it and see anything glaring, I'm waiting on final approval, then I will get with Nick. We'll get the commissioners to approve it, at which point it will go into the state technical review panel for final approval, and then it will be in effect. And then in June, there is a new food code coming out, so we will be training
Yeah.
on that.
Yeah, because remember when we had the whole food discussion about what this and that? We're back there again,
Oh,
so.
gosh, okay.
Yes, they've now changed it. It's not potentially hazardous, it's food. It's food controlled by temperature or time. Good times.
Any other pieces from you?
No, this is something from Beth Evans that she has been talking to us. She tried to have it. It's Dining with Diabetes, and it's a really good program. They've been doing it at the Vermilion County Health, or the health department's been involved. She tried to do it in, I think, December in Rosedale and just didn't get enough buy-in. So my suggestion was try it at the extension office
For the whole county.
and share, yeah, and I don't remember how many spots. Her hope was that we might be able, it's $45 for a couple from the same household. She hoped that we might be able to sponsor $10, $20
Registrations.
scholarships towards registration just to give them some buy-in. Obviously, if we did 10, it would be 200. I don't know what fund it would come out of. I think it's a good project, especially if you advertise it like at Burnett Manor and some of those places. Get with the doctor's offices, you're gonna know who needs it. So I said I would bring it up tonight. And this was an example of how she would advertise it if we did it that way. And the only other thing I have, I've been working with Nick and the commissioners and the town to try to figure out, there is not really a set law, but there are guidelines on how to plan and how many portalets you need per number of vendors, per people attending. That was a huge problem during festival. Had 2 property owners nearly come to blow the first Saturday. So I'm going to share this and see if we can't come up with some kind of a local
Like a
ordinance.
ratio?
Yes, requiring the property owners to provide so many per whatever. So I got that.
There's only one site I know of in town, over by the Sentinel.
And they reduced, that's the smallest number we've ever had.
Oh, wow.
There were like 4, maybe 6.
Seems like we should have another site somewhere. Maybe down at the depot, in the parking lot or something.
For what these property owners bring in, I've heard there are some really nice porta potties that they put on.
Trailers.
Yeah.
With the sink and stuff, those,
Yeah.
yeah.
Obviously, I don't think we can require what kind, but it would be a nice thing to do for the folks coming.
So you don't have any actions for us?
I don't believe so.
All right, public health nurse school liaison report.
Well, the only thing I've got, I did get the VFC approval done for 2024. I haven't ordered any more vaccines because we still have vaccines. And we are coordinating with the school to do some vaccines and stuff and some sports physicals like April and May. So, if we got anything else that we're working on a lot of stuff, but it's just getting it all together.
I would say that we have that immunization grant that, was brought up like a meeting, I think, ago, and it was applied for and received, but we never appropriated for it. I think that there was some miscommunication about it, but there are funds in there for immunizations. What I would like to do, my recommendation is that we have kind of a meeting internally to come up with a plan that will help us with the core services for immunizations. And then I would like to see the two of you work to think about what kind of pop-ups we could have in coordination with some of the Health First Parke County initiatives that we're going to create that shared calendar around. So then, we can start implementing those funds, but we have to have a plan around how we're going to use the money and how we're going to then get those monies, educated to the commissioners, the council on the appropriations, because we don't want to end up in a situation, where we're cart before the horse. So I think internally we need to come up with the plan on our immunization strategy, and that will help us with the core service maturity on immunizations. And I think that, between shingles and the flu and some of the things that we're not currently as much offering or advertising, I think that there could
RSV.
be potential. I think there could be a lot of potential for it to help us. What are your guys' thoughts?
We get a lot of calls about the shingles.
You guys agree with that?
Yeah.
Come up with an internal plan for the funding and set a budget.
Yeah, I think.
And for those of you who may not have seen that, Janet did send me a copy of it. So the whole lingo and the grant agreement and things like that, that was, again, it was, I would say, a miscommunication, but it's there, and we need a plan and how we seek to utilize the money and then get those things appropriated. So the clerk registrar report, Janet sent that out electronically to the team. She's under the weather tonight. But from a vital records perspective, I would say that her internal audit has demonstrated that there's a great relationship that I think that Liddy would echo with the Amish community, the midwives, and also the funeral home directors and such. I would say that we probably need to think about, as a board, our resilience plan with that position. I think that there's some opportunity that we're identifying from our internal audit that we need to probably maybe partner with some volunteer organizations or clubs to help get some of the older records put into our new program with WIN, because that's a lot of records that is a huge overtaking. So there are other communities, other counties that I have learned through the involvement with the local public health department info call that we're on, that are using internships and other things like that to get people involved. So, more to come on that. And then, again, what additional resources will we need? So she was one that's turned in her internal audit, so I've at least got to see that. But I think, Melissa, you're going to help me try to get all this pulled together in one document, so then we can get this back to everybody to start looking at. It's very enlightening. Yeah, it's very enlightening. And I would say the other piece that I talked to Lydia about is that we'll have to advertise, but I'm going to have an executive session that I'm going to hold where we need to set job descriptions for performance and all the roles and expectations, because as we start looking at all these core services, you know, you've got lots of hats that everybody's trying to pick up and do these things, and that's where we need to identify, you know, so that there's no role confusion and we have clarity and we have clear expectations, that we're going to be able to get those job descriptions. Now, to be clear, we're not going to action on these job descriptions. It'll be a discussion of job descriptions, and then those would come back to the board for actioning. And of course, you know, the staff are going to have input to their individual roles and responsibilities and job descriptions for our consideration at the executive session. But I think that we really need to have that playing field, because everything is just really moving really quick with this Health First Parke County plan. And there's just, you know, the state says, you know, just take it one step at a time. You're not going to be able to do everything, but you got to build your foundation this year. And so that's what we're going to do. But I think that, you know, we've got some really good ideas coming out of Health First Parke County Committee, maybe partnering with some of the employers for some health screening, working on some food insecurity pieces, working on getting those, you know, those immunization pop-ups going, getting the lead testing done, working more cohesively with the schools, and trying to get just those inroads established. And as long as we're doing our best and doing our effort to in good faith, then I think that we're going to be winners, you know, in the end. So that's what I would say.
Yeah, can't get it all. I mean, hopefully we can get a good start, but they can't kill us for not.
Well, and you would be glad to know, since you were such a big proponent of the life jacket line in our budget around trauma and injury prevention, they're working with the park board to get those swim lessons back in place for Rockville public pools.
Yes.
We have a meeting the 15th, and Ross Akers and Luke Waltz were kind of taking that to task as to find out, you know, really do a deep dive on. Didn't mean to do that, but do a deep dive on swimming lessons, and you know what what's our best approach to it, because we've, as a park board for years, we've been, I mean, there's just not a lot out there as far as guidance or certification, and we've been willing to pay, even as a park board, for certify, you know, to get the certifications for our lifeguards and everything, because we've been paying for that. And it's just, we just have not been able to.
And we've had people express interest in giving, but then they just, it falls through.
So, yeah.
So we're working on that, because I know that was one of your passion projects.
And we have the creeks and the water,
Yeah.
2 lakes, and
And Health First Parke County, there was one, I don't know if it was in the January, February meeting, that there was a mention of maybe us partnering with DNR.
That was me,
Yeah.
They're big proponents of it, so I'm gonna see.
Yeah, so
what
we're
their
going to see if we
resources
can't
are.
get some input from DNR or with the conservation officers or whatever we need to do to, you know, make those things available. So it's been encouraging so far.
yeah.
Child Protective Services was going to get life jackets and stuff too, and they wanted to do something about swimming lessons, and so
You know, people have backyard pools. They just let kids get
well, I
in.
suggested daycare
I mean,
daycares
and
get
don't
involved.
supervise.
You know,
Well, when we were guards, it was just a given. You helped for a week out of the year. You gave lessons, and we even gave private lessons.
I
in
did.
addition.
That's how I got extra money. It
Yeah,
was cash.
Absolutely.
Well, I know Nancy said she'll see somebody on the street. Oh, I taught them how to swim.
Yes. Yeah.
JD and Anna Berry, they were my kids.
Aw.
It was Katie Baumgardner, threw up all over me. Threw up all over me and then ripped my suit.
I remember Anna Berry's first dive.
Oh.
And
I don't remember the
JD's.
name. I just remember I threw a mom out because she was
It's hard. Yeah.
she was not letting that kid put the face.
Do we have any? I'll go ahead and be kind of timed. Is there any additional comments or actions that we need to put before the board tonight? Can I have a motion to adjourn?
Make
make a motion to adjourn.
All right. Thanks, Mary Jo, and thanks, Angela, for joining.